On August the 15th, 2016, local ambulance crews raced around town performing their duties with competence and courage, as always. In addition to treating heart attacks, traumas, and other common emergencies, the emergency technicians had grown accustomed to resuscitating patients suffering from opioid overdoses. That day, however, they were called upon to save 28 overdose patients, a rate of more than 1 per hour. These figures might not seem remarkable compared to a sprawling metropolis with millions of residents. In this case, though, we're talking about a city that at the time had roughly 48,000 inhabitants. Of those, a staggering 12,000, 1 in 4 were addicted to prescription pills, heroin, fentanyl, or a combination of opioid and stimulant drugs. The city soon became known as the overdose capital, or even the drug death capital of America, emerging as the epicenter of the tragic opioid epidemic that devastated so many lives across the nation. But while this small city has made headlines due to the high incidence of overdosing patients, its citizens deserve recognition and credit for the proactive measures that they've put in place to address this widespread crisis. This is Huntington, West Virginia, and this is the story of its fall, but also its rise. The city of Huntington is located in the western portion of West Virginia near the borders of Ohio and Kentucky. Today, it's home to roughly 45,000 residents and serves as the seat of Cabell County. Thanks to its proximity to the Ohio River, Huntington played a significant role in the region's economy during the 19th and 20th centuries, serving as a major transport hub for Appalachian timber and coal. Huntington's no stranger to tragedy, though. On November 14th, 1970, a Southern Airways flight crashed into a hill just outside the city, claiming the lives of 75 passengers. Most of those killed were players, coaches, and supporters of Marshall University's beloved football team. The impact on the community was so severe that residents now mark Huntington's history in 2 distinct eras, before and after the crash. Nevertheless, the city eventually came together to mourn, heal, and rebuild. This profound recovery from loss was immortalized in 2 films, the 2000 documentary Marshall University, Ashes to Glory, and the 2006 movie We Are Marshall. A few years later, however, the county seat of Cabell County gained nationwide notoriety for a very different reason: its association with the escalating opioid crisis. A 2016 CNN article described Huntington as America's drug death capital, and it went into detail how 1 in 4 residents here is hooked on heroin or some other opioid, local health officials say. That means a staggering 12,000 people are struggling with opioid addiction. Huntington was not an isolated case. The visible suffering in the community was a clear symptom of an opioid epidemic gripping much of the US, a crisis that became especially harrowing in West Virginia. In 2016, the state recorded the highest rate of opioid overdose deaths with 40 fatalities per 100,000 residents, a rate 169% higher than the national average. So why had the opioid crisis become so severe in West Virginia and in Cabell County in particular? Well, according to Sam Workman, director of the Institute for Policy Research and Public Affairs at West Virginia University, the origins lie in 2 concomitant factors. First, the local coal mining industry, and particularly its decline. When the workforce was halved in the early 1990s, many former miners and their families were left with few prospects and had to bear the long-term effects of years of physically grueling work. Then came the introduction of powerful opioid prescription drugs such as oxycodone, marketed as OxyContin, and first licensed by the US Food and Drug Administration in December 1995. As Workman states, the physical wear and tear laid the foundation for a broader crisis. As blue-collar jobs dried up, pharmaceutical companies like Purdue Pharma started promoting new pain relief medications like OxyContin. 4 years after it was introduced, the drug was being prescribed in some West Virginia counties nearly 5 times more than the national average. End quote. This was the proverbial perfect storm. On one hand, communities were in dire need of effective pain relief drugs. On the other, pharmaceutical companies were more than willing to aggressively promote these medications. However, the pharmaceutical market does not rely solely on supply and demand. An intermediary, a healthcare professional issuing a prescription, is also required. Since the early 2000s, it appeared that healthcare professionals in West Virginia were signing millions of such scripts. The disproportionate volume of prescriptions for oxycodone, hydrocodone, and other painkillers soon caught the attention of the West Virginia Bureau of Criminal Investigation. In 2001, State Police Sergeant Mike Smith uncovered one of many so-called pill mills clinics, pharmacies or wellness centers typically located in small rural towns that were churning out hundreds of prescriptions each day with very little supervision or due process. At times, these mills were managed by career criminals who had uncovered a profitable business model. Instead of trafficking illegal drugs, they made millions by peddling prescriptions for legal medications. As reported by The Guardian, a group of doctors were set up by a former pimp just out of federal prison for running a gay prostitution ring in Washington, D.C. Pill mills then proliferated in Cabell County thanks in part to its strategic location at the crossroads of 3 states. Consequently, between 2006 and 2014, over 81 million opioid pills found their way to Huntington and the surrounding county. At that time, Cabell's population was just under 97,000, meaning the area received about 837 pills per inhabitant. As we will learn later, these shipments were not managed by the manufacturers of the drugs, but by wholesale distributors, McKesson, AmerisourceBergen, and Cardinal Health handling most orders. The effects of this opioid tsunami in Huntington and Cabell soon became apparent. In 2015, opioid overdose became the 3rd most frequent cause of death in the area, surpassed only by heart disease and cancer. For Huntington's emergency medical services, pulling patients from the brink of death due to overdoses became a daily routine. On one particularly grueling day, August 15, 2016, ambulance crews recorded 28 overdose cases. There were occasions when emergency personnel treated as many as 8 overdose victims in just 20 minutes. And of course, the crisis wasn't just limited to Huntington. It had spread nationwide. In 2016, the Centers for Disease Control and Prevention, or CDC, implemented strict guidelines to restrict opioid prescriptions. However, this measure proved counterproductive. With locals no longer able to access oxycodone or hydrocodone, they initially switched to other prescription drugs, such as the anticonvulsant gabapentin, and later resorted to buying heroin from street dealers. Heroin users soon escalated to injecting a far more potent drug, like fentanyl, which can be up to 100 times stronger than morphine, or carfentanil, a drug originally synthesized as a tranquilizer for elephants that is roughly 10,000 times more potent than morphine. Often, they combined these with stimulants like cocaine and methamphetamine. By 2017, Cabell County's opioid overdose death rate had soared to 72.7 per 100,000 inhabitants, almost 5 times the national average. In the ensuing years, West Virginia continued to top the grim leaderboard of overdose deaths in the United States, as reported by the CDC. In 2022, the state experienced 1,335 deaths, a rate of 80.9 per 100,000 inhabitants, with the vast majority of these fatal cases concentrated in Kanawha and Cabell counties. One of the most harrowing consequences of widespread drug consumption was its impact on newborn babies. In 2016, 1 in 10 babies born at Cabell Huntington Hospital suffered from neonatal abstinence syndrome, NAS, meaning they experienced withdrawal symptoms from heroin, cocaine, alcohol, or a combination of substances. Many of these infants were expected to face long-term neurological problems, with 10% also contracting hepatitis C. This phenomenon extended beyond Huntington. In 2016, West Virginia was reported to have the highest incidence of NAS in the region, with a rate of 33.4 per 1,000 babies. What set Huntington apart was its determination to fight back. The community took on the challenge by launching coordinated efforts designed to support both the affected babies and their families, working tirelessly to reverse the tide of this devastating crisis. Sarah Murray and Rhonda Edmonds, 2 pediatric nurses at Cabell Huntington Hospital, made the first significant effort in this area. In 2016, the duo opened a separate facility known as Lily's Place, dedicated to helping babies suffering from NAS and their young mothers. After giving birth, each mother and her newborn child could spend protected time in their own room, where specialized nurses taught them the basic yet vital skills needed to care for their babies. In 2017, the hospital expanded its efforts with the launch of a broader initiative called Healthy Connections, described as, quote, a community coalition designed to serve women struggling with substance use disorder. Under this program, a new mother suffering from substance abuse was first connected with a family navigator, whose primary role was to assess her needs. The navigator then linked the mother with a peer support group of women facing similar challenges, and finally offered her options for recovery services. The next priority is to reach out to the baby's father and other relatives, uniting them into a supportive network that provides care and stability for the newborn while the mother undergoes her recovery process. Both the mother and the baby will be referred to the Knowledge in Developmental Steps Clinic, commonly known as the Kids Clinic. At the Kids Clinic, they will have convenient access to a team of specialists, including a pediatrician, a neurologist, a physical therapist, a speech pathologist, and a social worker. This collaborative team is dedicated to assisting babies suffering from NAS in developing healthy brains and bodies. Additionally, as the babies progress through their first few weeks, they will be enrolled in the CARES program, standing for the Center for Addiction Research, Education and Support. Designed specifically for children experiencing NAS, this program supports their development throughout the first 5 years of life, ensuring a smooth transition into the school system. The initiatives implemented at the hospital demonstrate that Huntington is not merely the drug death capital of America. In fact, over the past 2 decades, the city has earned another far more positive title, the capital of efforts to combat drug death. In November 2014, Mayor Steve Williams established the local Office of Drug Control Policy to collect and analyze data on drug usage, coordinating efforts with 50 specialized agencies and organizations. Then in early 2015, Huntington's authorities launched West Virginia's first syringe exchange program, which distributed 150,000 clean syringes to more than 1,700 individuals in its first year. This program not only provided safe paraphernalia, but also offered medical assessments and specialized referrals to addicts seeking recovery. In the same year, Huntington opened its first dedicated detox ward, equipped with 8 beds. In 2016, medical and emergency personnel, including police officers, were equipped with a critical weapon in the fight against overdose: injectable or inhalable naloxone, a powerful opioid antagonist capable of reversing overdose effects. Even Mayor Williams carried a naloxone injector wherever he went. You may recall that on August 15, 2016, ambulance crews responded to 28 overdose cases. Thanks to the swift intervention of emergency medical technicians and their prompt use of naloxone, nobody died that day. But reviving patients from the brink of death is only one facet of this ongoing struggle. In 2017, Huntington authorities addressed the aftermath of an overdose by establishing the Quick Response Team. Within 3 days of an overdose, a patient or a member of their family receives a visit from a peer recovery coach, a paramedic, a police officer, and a faith leader. Crucially, the Quick Response Team also serves a preventative role. Families worried that their loved ones might be at risk can contact the team to arrange a welfare check. This innovation clearly made an impact. In early 2017, EMT crews faced up to 6 overdose cases per 12-hour shift, averaging 360 cases per month. After the introduction of quick response teams, the number of ambulance calls dropped by 40%. In 2020, Mayor Williams joined forces with local healthcare providers and Marshall University to design a resiliency plan addressing both short and long-term challenges. Short-term goals included expanding hospital care for overdose patients and providing valuable educational resources. More importantly, the city's long-range strategy aims to tackle the root cause of poor health and substance abuse, issues such as unemployment and inadequate housing. Beyond addressing the community challenges, the city of Huntington and Carbell County also sought to secure compensation from the companies deemed responsible for the opioid epidemic. In April 2021, Carbell County Attorney Paul Farrell filed a lawsuit against medicine wholesalers McKesson, AmerisourceBergen, and Cardinal Health, accusing them of turning Huntington into the ground zero of the opioid epidemic sweeping the nation. Farrell argued that these distributors should be held accountable for recklessly flooding the community with millions of prescription painkillers. He demanded that they pay $2.5 billion in damages, a sum intended to help address the ongoing substance addiction crisis. More precisely, the county attorney charged the defendants with creating a public nuisance, meaning their conduct had interfered with the rights of the community at large. He backed his claim by quoting Article 549 of the West Virginia Legal Code, which states, "Such public nuisance endangers the health, safety, and welfare of the community and is dangerous and detrimental to the public health, may violate the laws of the city and/or state, as well as obstruct the community from reasonable and comfortable use of property." In July 2022, U.S. District Judge David Farber delivered a verdict that was not what Huntington had anticipated. The judge exonerated 3 wholesalers, stating, "Plaintiffs failed to show that the volume of prescription opioids distributed in Carbell/Huntington was due to unreasonable conduct on the part of the defendants." He further added, "There is nothing unreasonable about distributing controlled substances to fulfill legally written prescriptions." Earlier investigations by the West Virginia Bureau of Criminal Investigation revealed that millions of these prescriptions were issued by so-called pill mills. It can therefore be argued that those prescriptions were not 100% legally written. In May 2024, Huntington and Carbell County appealed the initial verdict to West Virginia Supreme Court. At the time of researching this episode, the court has not yet delivered its decision. By mid-2024, the courageous residents of Huntington continued their fight against the scourge of overdose deaths. Healthcare authorities had opened additional facilities to help mitigate the damage caused by substance abuse. Karen's Place, for example, is a centre dedicated to supporting mums-to-be throughout pregnancy and helping manage withdrawal symptoms in their babies. Similarly, there is a detox centre called Recovery Points, which is managed entirely by former addicts who've achieved full recovery. One of these recovered individuals, Richie Armstrong, spoke to Sky News reporter Mark Stone in the summer of 2024, stating, "Huntington's recovery community is huge. On the 22nd, next week, I'll have 8 years of continuous sobriety. And this is all I've done since I've been sober, is work in the field of recovery. I made the decision early in my sobriety that the recovery world was going to be my life. And it absolutely is 100% my life." Thanks to the tireless work of former drug abuse victims like Richie, along with dedicated medical professionals, emergency personnel, and local authorities, Huntington is slowly clawing back lost ground, reclaiming the lives of its residents from the darkness of addiction and abuse. The dark days when ambulance crews had to attend to 28 overdose victims in a single day are hopefully behind us. In August 2024, city statistics showed that the figures had dropped to 10 overdoses per week, cases that seldom become fatal thanks to the prompt intervention and dedication of emergency personnel. This statistic still translates to a total of 520 overdose cases per year, or roughly 1 case per 86 inhabitants, which is still far too high for a city of 45,000 souls. Nonetheless, it is a massive improvement, a testament to the dedication of local authorities and especially to those who were once snatched from the jaws of death and are now willing to support others on their path to recovery. The road to total victory against the stubborn foe of widespread addiction remains long and arduous, but what the people of Huntington have proven again and again is that they certainly do not intend to surrender. Thank you for watching.